Hi guys, it's Vanessa and I'm going to focus on the optimal self-management of diabetes and use the shared decision-making theory. Diabetes is a chronic illness that affects the way the body turns food into energy. Untreated diabetes is defined as high blood sugar levels and symptoms such as increased urination, increased thirst, blurry vision, headaches, and dizziness may develop. High blood sugar levels damage almost every single organ in the body, including the heart, the kidneys, the skin, the nerves, the GI tract, and even the teeth. Exploring how to increase optimal self-management of diabetes is very important because diabetic patients provide more than 90% of their own daily care. As nurses, we aim to provide our patients with the correct resources and education, but sometimes there are barriers that prevent these patients from reaching optimal health. As we know, the complications of diabetes are very detrimental and they can really take a negative toll in someone's life, especially when we begin talking about amputations and the loss of vision and other comorbidities. It's really helpful and really convenient that nurses are both at the development stage of programs and also at the clinical stage, because they serve to bridge the gap between research and care. The shared decision-making approach is defined as collaboration between healthcare providers and patients. It requires patients to be involved in the decisions involving their health. In the shared decision-making approach, nurses are viewed as experts in evidence and the medical aspect of the disease, while patients are viewed as experts as to how this disease affects their lives. Together, they become a team and they look at the patient's values and their lifestyles and at the evidence available, and they create a plan that is going to be specific to this patient and hopefully help them reach the optimal self-management of diabetes. It's really important to consider a patient's education, their nutrition, schedule, and income. We wouldn't want to recommend a book to a diabetic patient who can't read. We should also consider the evidence that's available. For example, studies have shown that metformin is recommended on very limited evidence. This means that there could be other medication regimens that would be beneficial for this patient once we start investigating and poking at the patient's values and lifestyle. Maybe the patient doesn't want to take metformin twice a day and would rather take insulin once a day. It's stuff like this that the shared decision making connects to the optimal self-management of diabetes. It's very important to merge the two together so that we can create a plan that's going to benefit this patient to the maximum.